I was really amazed at the physiology of the heart and the lungs and how, as a surgeon, you could manipulate that and make things better for a patient. There were a couple of things ingrained in me as part of my military training. One is that you're part of a bigger team, and really working together, you can accomplish things that as an individual you wouldn't be able to do. And then leadership within that team. As the surgeon, you have responsibility for how things go with the conduct of the operation and things along those lines, but you don't do everything that goes into excellent patient care. You know, I've had a couple of deployments into combat environments where I was the only cardiothoracic surgeon at the hospital. And if you can't fix the problem that you're facing, there's really nobody to call on or rely on or send the patient to, and so it's really up to you. That experience occurred at kind of a key point in my career. So the most rewarding part of being a cardiothoracic surgeon is seeing patients have good outcomes from life-threatening situations. Oftentimes we have to deal with complications or presentations of patients that are really critical in how they're doing, and to be able to take them through that and get them better and get them home and then see them in follow-up where they're doing well is really what I find rewarding. The areas that I've taken a passion for and really enjoy doing is aortic valve disease and aortic aneurysm disease. So a trans-catheter aortic valve replacement, often known as a TAVR, T-A-V-R, is an approach where you can replace a patient's aortic valve without having to open their chest and put them on a bypass machine. But the data has really shown that for particularly older patients that are frail, that would not necessarily tolerate a cardiac surgery procedure in the traditional aspect, they do remarkably well with these trans-catheter approaches. And what we found is that the stroke risk and the other complications are really equal to, and in some cases better than, the traditional surgical approaches. I would say the thing that makes me stand out from other surgeons is really I am able to remain calm and stay focused on what needs to be done even when complications happen. And when you can do that, you can salvage a situation that otherwise could be negative and have a good outcome despite the problems that you encounter during the procedure.